bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hello and thank you for joining us. I'm Lisa Aprati and this is Comcast Newsmakers coming to you from the state capitol in Springfield. This hour's newsmaker is Elizabeth Coulson, state representative for the 17th district, and today we'll be talking about young adult health insurance. Representative, great to have you back on the program.
It's nice to be back.
So you were actually one of the chief sponsors of this particular piece of legislation that was passed in the last session but took effect as of June 1st of this year. Tell me a little bit about this package that's come together.
Well, what's so exciting about young adults many times have a hard time getting health insurance. They're one of the biggest populations of uninsured in the state of Illinois. Almost 300,000 young adults from 19 to 26 don't have insurance. And there's a variety of reasons. Some of it is because they're in college part-time, can't be on their parents' insurance. Some of it is because their first job doesn't cover them. And what we did with this bill, and what's so exciting and why I want your viewers to know about it, is we allowed those young adults to stay on their parents' coverage up till their 26th birthday. Okay. Doesn't matter if they're in college, it doesn't matter if they already have a job, as long as they're still unmarried and are dependents of their parents, they can stay on their parents' insurance. So it's a win-win for everybody.
So was this a main reason why this was actually addressed, because of the economy and because of how unstable jobs are right now?
Well, actually, you know, we started working on this bill before that, but it definitely helps in this kind of economy. Many first jobs have been having to cut back on benefits, and the major benefit that is cut back is health insurance. And young adults may not be likely to be sick, but if they have an accident, they're likely to cost a lot of money. Car accident or other types of accidents are the most common injury for a young adult. And to be uninsured with that kind of catastrophic problem is scary to everybody, to parents, to children, and those 19 to 26-year-olds don't always think they need that insurance. So what's great about this is that we worked it out with insurance companies, with the young adults themselves, and they actually were down here lobbying, and also with parents to be able to have them have less expensive insurance coverage, so we have fewer uninsured in the state of Illinois, and I'm excited.
You've also extended this for individuals who are part of the military.
Right, and we were able to get that to a little bit older, so if someone goes into the military right after high school or right after college, we were able to get military dependents up to 30.
Okay.
We would have liked to have gone higher with other young adults, but in their first job right after college or that first job right after high school, they can stay on their parents' insurance.
So if they are going to college full-time, they're automatically covered under
usually
their
they're still
parents'
covered.
insurance.
Yeah, and up to 22 or 23 depending on their insurance. But what this bill did is if they're part-time in college, or they have other, maybe they're going to school for 1 year. My niece is a good example. She went to school for a year, took off a year, went back to school. She can still stay on her parents' coverage that whole time. And so it doesn't make kids stay in college just to have health insurance. And that's also a good option for them.
Well, and really talking about the economy and the fact that there's so many jobs out there, they may be providing employment, but they're not giving the full benefits like they used to do back in the day.
Right. And so what we're doing is really, I think, helping the economy by allowing those kids to have group insurance on their parents' insurance. It's less expensive for them, it's less expensive for society, and that's the win-win. We don't have uninsured young adults who might be catastrophically impacted with a huge bankruptcy bill because they were in a car accident.
And you've gotten a lot of positive feedback since this took effect?
Parents are so thrilled, and one of the reasons I wanted to talk to you about it is some of the parents aren't aware of it because they're just now able to do their open enrollment, sometimes in the fall, and this is the time to get your child who's up to 26 covered by your insurance company.
Wonderful. Well,
in Illinois.
Thank you so much for coming on and talking to us about the young adult health insurance that was just passed this last session. Always a pleasure, and thank you for doing this. That's wonderful. This hour's newsmaker has been State Representative Elizabeth Coulson. I'm Lisa Aprati, and thank you so much for joining us on this edition of Comcast Newsmakers.